Look at those latest COVID-19 numbers from the Mississippi Department of Health came out just this morning. 71 new cases. That brings our total number to 320 here in Mississippi. Now, the largest number of cases are in Hinds County. We have 31 here. Harrison and DeSoto counties. Nearly 1,900 people have been tested so far across the state. There's only one confirmed death at this time.
Tomorrow morning, Governor Tate Reeves will address the media about the coronavirus outbreak and impact on the state. He spent this past week in self-quarantine. Today, he addressed a number of topics in a Facebook Live, including the rumor of a lockdown of interstates and a total state lockdown.
Mississippi's never going to be China. Mississippi's never going to be North Korea. We understand that people are nervous. We understand that people are scared. What I would encourage you to do is, if you feel that a statewide lockdown should be occurring, then you should put yourself on individual lockdown. If that's what you believe is best for you and your family, then that's fine. That is not the guidance that we are getting from our experts.
The governor's news conference is at the mansion just after 10 tomorrow morning. We will bring it to you live on air and at WJTV.com.
Good afternoon, everybody. Thank you for joining us. I'm Andrew Harrison. Tate Reeves out of that self-imposed quarantine. He addressed the media this morning from the steps of the governor's mansion. He talked about Mississippi's response to COVID-19, urged everybody to stay at home if they can. Now, his main message, he will sign an executive order banning gatherings of 10 or more people. That ban includes church services, weddings, and funerals. Restaurants and businesses will also be ordered to close their dining areas. Drive-thru and delivery services will only be allowed. The order would also prohibit visitations to hospitals and long-term health care facilities. And according to the order, non-essential employees should work from home only, and only essential workers will be allowed to leave their house to go to their place of employment. Governor did stop short of ordering a statewide lockdown, though.
There were people that we know that were infected that attended either a wedding or a funeral, and that led to additional spread of the virus. And so this is a ever-evolving crisis, one that is changing day by day. My commitment is to listen to the experts, but at this time we do not see that as the best course of action, to see a statewide lockdown.
Fairgrounds now. Drive-through testing for coronavirus began today. We began seeing tests going up last week, and at last count, 320 Mississippians have tested positive for the virus.
Have some, like I said, amplified efforts around our telehealth capabilities. Also, in the very near future, we are working to develop an off-site screening and testing capabilities and facility. It is very important, and you'll hear Dr. Jones speak to this in some of his comments. It is very important that the public understand who should be tested and who should be screened and who should be tested. We do not have the capabilities at any level around the country to do mass testing. The numbers of tests, the viral media that is required, and all of the components are just not available for mass nationwide or statewide testing. It is important that we use the resources that we have, particularly the tests that are available for those patients and individuals that most importantly need it. But we have had a student, we've had one student that has tested positive. We have had one nurse that has tested positive. And at this moment, we have 0 patients that have tested positive.
As we now know, community spread has started. It is in our community. From the reports that we're getting from our surrounding areas, such as New Orleans, where they're seeing very rapid increases in the number of cases as testing is increasing. And not just cases, but the number of critically ill patients associated with those cases. To that end, we are ramping up all of our contingency planning to be prepared for a tidal wave of patients that we know is about to hit us. If we see in the United States, in wherever it is, anything like the experience in Italy or the experience that is now going on in France, no one can be prepared for that. No, there is no country in the world, no healthcare system in the world that can be prepared for that. So we're preparing the best we can, and we know how, but the nature of healthcare in this country and around the world